In 3, 2, hello, you are listening to Finding My Way, a podcast where we interview students and faculty of various academic disciplines to help prospective students learn more about the fields that they're interested in. Today, we'll be covering the Master of Health Administration degree offered at USC through the Price School of Public Policy. Here to tell us a bit more about this degree from Thousand Oaks, California, Nikhil Bajpai. Nick, thank you so much for joining us here today.
Thank you for having me. I'm honored to be here, and I really love what you're doing. So
I'm excited. You are actually our very first post-grad student to come over here and interview, and very excited to learn a little bit more about your journey to MHA. So I did want to ask you, where did you do your undergrad?
So I did my undergrad at UC Santa Barbara. I studied psychological and brain sciences. And, I didn't really know what I wanted to do in undergrad. I kind of went the bio route. I thought I wanted to be a doctor. Mm-hmm. I kind of had my own little health episode, and I really saw the impact that administrators could have. And you don't really get to see a lot of that. It's kind of behind the scenes. So I quickly changed my major when I figured out I didn't want to deal with the OChem or the physics. And I went to psychological and brain sciences, loved it. Mm-hmm. I think, learning about human interactions and just how people work in general and how they interact is very beneficial to just being a leader in general, no matter what industry you're in.
That's amazing. So did you go into it knowing that you wanted to do a master's next level of HA, or did you want to be a doctor going into it?
I wanted to be a doctor going into it. I always knew I was going to have some higher level degree besides a BS or a BA. I didn't know what at the time. I don't know whether I wanted to go and, become an MP or PA, or an MD or an RN even, and all of the above. But I just kind of just fell in my lap, and I fell in love with it. And I think with the skill set that I have right now, I think I can be very successful and do a lot of good in this industry. So
yeah, not a bad city to do it too. No, LA is kind of a fun one. Yeah. So you did 4 years at UCSB studying the equivalence of psychology, correct?
Correct. I mean, it's a little bit of psychology and neurosciences. It's a little bit of a blend. Uh-huh. So we kind of learn the psychology aspect of it first, and then we kind of go into the neuroscience aspect of it and how they kind of interact with each other. So it was really interesting.
That sounds pretty cool.
Yeah.
So what were some of the main takeaways that you got from it?
Humans are very complicated.
Really?
Yeah.
Crazy.
There's a lot that goes on into people's perceptions and thoughts and stereotypes and whatever it may be. Mm-hmm. And I think getting a good grasp of what really goes into people's decision making can really help you make meaningful impact down the road and in the future.
Fair.
Yeah, I mean, I really love psych. I think it was kind of the foundation to me actually wanting to go get my MHA and seeing kind of what an impact that leaders could have through that route.
Yeah, because you said that when you had your own health conflicts come up, you looked up to the health admins instead of the doctors.
Yeah.
Was there a reason for that?
Yeah, so, there's a lot of complications with scheduling, referrals, and insurance and getting that covered and stuff like that. So a lot of times you are dealing with administrators, and they're kind of the behind the scenes group that kind of deals with that whole aspect and kind of allows doctors to do what they do. Mm-hmm. And I didn't even know that at the time. When I thought of medicine, I was like, oh, it's all about being a physician. It's all about being a nurse or a advanced practice provider. And so seeing that side really opened my eyes and really kind of pushed me to go this route.
So what do admins really do?
There's a lot of different things. I mean, we could talk about this for 3 days if we really wanted to, mm-hmm. but you can go in various different routes. You can go into quality, you can go into PI, you can go to patient experience. You could really do anything you want. Mm-hmm. So there's a famous saying. There's a saying that there's two types of people in healthcare. There's people who take care of other people, and there's people who take care of those who take care of other people. And so I feel like a lot of administration is just kind of making sure that care delivery is seamless and making sure that patients and providers are getting everything they need in order to properly lead to the successful resolution of a disease or an ailment or whatever it may be.
I love that. That's actually a really cool quote. Nobody ever thinks about who has the doctor's backs.
Yeah,
so in a way that is
exactly. And I think that's where a lot of discrepancy gets in between providers and administration. I think that's kind of where that angst and angerness kind of comes from, and the disagreement between both parties. But for them to realize that we have their back and we both want the same thing, and that's our patient's best interest. I think that's very valuable, and I think that is the path forward to both parties not fighting like cats and dogs.
Yeah. So when you were first applying to schools after you got your undergrad, what made you choose USC?
So I applied very late. So there's only a select few of schools that actually were still accepting applications. USC happened to be one of them. I also applied to Texas A&M, University of Utah, and University of Arizona. Got into all of them, and I really liked Utah's program, and I really liked Texas A&M's program. Both are well renowned, but USC being USC with its name,
Of course.
I think that kind of really drove me to come here. But also the fact that I was born here. I was raised here. I have never left here. I visited numerous places, and every time I go somewhere, I'm like, this is home. Like, Southern California is home to me. So I think that was a large part of it too.
Was it kind of a good feeling coming back home after 4 years in Santa Barbara and re-experiencing the city in a new light?
It was interesting because I had this whole idea in my head that, I was going to be living on the beach for the rest of my life.
Yeah.
Living like a king on the beach, overlooking the beach, seeing these beautiful sunsets, at a great institution. And I kind of had it set, that was the rest of my life. And unfortunately, that's not it. So coming home was a little bit of a shock. I was definitely, I don't know, what's the right word? I guess anxious being at home.
Okay.
So getting out of there after a few months was nice. There was that whole COVID aspect of things too, so I was home either way, regardless, for about 6 months. And I think that probably drove me to be a little more anxious about staying at home, and that was the nice thing about USC too. It was just far enough where it wasn't traveling distance every time you were going to campus. So finding a place out here and just kind of living my own life as an adult was really important to me.
Sounds amazing. And do you feel like the city now, as an adult, do you see it in like a completely new light than when you were just a kid growing up in Thousand Oaks?
Absolutely. I don't think I really understood the gravity of what living in downtown Los Angeles meant.
It's kind of crazy.
It's
right?
It's wild.
Yeah.
To say the least. And it's also really eye-opening. You really see that not everyone lives the same life that you live, and not everyone's as privileged as you.
Yeah.
And so you're kind of secluded in Thousand Oaks and all those little, in Ventura County, that whole area. And you don't get to see that. And so coming here and seeing that and going into health admin, that was something that was really like eye-opening for me and really inspiring. It was like, you know what, these are the people that we do need to help.
Yeah.
And we're not helping them right now. So what are ways we can help them?
I agree. I think I can relate to you very heavily because I came from Westwood, which is right next to UCLA, for everybody who doesn't know. And it's very much a bubble everywhere else, where when you actually come to downtown, you see what extreme poverty looks like and the toll it takes on a lot of people around here. It forces you to go into a real world, which is one thing I really appreciate about USC. The fact that it doesn't hide the fact that there's a real world out there and you're kind of in that real world. USC itself is a bubble around the school 100% within like a mile radius, but by giving you the opportunity to go around the city, interact with people of all sorts of different experiences, different backgrounds, I feel like you are having a more well-rounded human and also student experience, being a student of the world and just seeing what it's all like. Yeah.
I mean, I couldn't have said it better myself. I feel like, USC itself is a bubble, and once you step outside those gates, you really see the real world. I mean, just crossing the street over to the village, it's two different worlds, and it's a matter of 100 feet.
Yeah.
And it's just thinking about that, it's the same thing with the Tijuana and Chula Vista. I mean, it's just a border, but if you look at the disparities between both sides, I mean, you see that Tijuana is a completely different socioeconomic status than Chula Vista is.
Yeah.
And it's really disheartening to see that it's just a boundary. That's all it is. I mean, USC's walls, all it is a boundary.
That's crazy. But it's also crazy to think where USC has kind of come from.
Yeah.
Because I think if you look at USC 40 years ago, you would not be able to recognize it now.
Yeah.
Like, no village whatsoever. I don't even think there was DPS or anything either back then.
I mean, probably not.
Probably not. Like, it's very strange how much a boundary does
Yeah.
have such a significant impact.
Absolutely, and I mean, you're seeing the effect of what USC is doing to surrounding areas. I mean, they're buying plots of land and then building their properties on it. But it is really helpful. I mean, previously there was no Target in this area. I mean, except downtown LA, no Trader Joe's. So just having that and allowing people from like South Central and downtown LA to come and shop here is I think very beneficial. So I think there's a lot of good things that comes out of it as well.
I agree. I also think that in the sense of community outreach programs and everything like that, it's very helpful in the sense where if you want to go into medicine, there are a lot of opportunities, I think, to help impact the community. Have you guys had any of those experiences through the MHA program?
So we haven't done anything per se one-on-one with community involvement. I mean, we do volunteer opportunities. We have a bunch of volunteering that we do. We go to a local food bank, beach cleanups, whatever it may be. And then within our residencies, we also do a lot of community involvement in that realm as well.
Okay.
So nothing really program specific. But yeah, we all get together sometimes, go do a beach cleanup, or always go to the local food bank or whatever it may be.
That's pretty nice.
Yeah.
What is the community like for that?
What do you mean?
In the MHA program.
Yeah, so the MHA program is very interesting. I think all master's programs just inherently are interesting. I think when you put 21-year-olds with 45-year-olds, you're in for a crazy dynamic. But it's also really cool because you get to see people's perspectives who have years on you, and they've been through so much that you haven't even seen yet. I mean, you think you know it all, and then you meet someone who's like, you were all wrong. And then slowly by time you start to realize that that's actually true. I mean, you don't actually know it all.
Yeah.
And so I love that dynamic of it, and they have a lot more knowledge and wisdom to kind of spread to us, especially because they've been in the industry a little bit longer, and they've whether it was healthcare or not, they've just seen a lot. So I love my fellow MHAers. They're all really great people, and I think all in it for the right reasons who are just trying to make a change.
And what kinds of people typically go into this major?
It's a wide range. You have people who are introverted, you have people who are extroverted, you have people who are great with analytical skills, and you have people who are really good leaders and really good at communicating. And so I think that's kind of the beautiful thing about this degree is, like I said, you could do anything you want. I mean, you could go to the pharma industry, you could go work at hospitals, you could go work at a skilled nursing facility, you could go work at Behavioral Institute. I mean, there's a university. I mean, you name it.
The door's pretty wide open.
Yeah, it's exactly.
But as far as the actual work goes, I feel like that's what I always get a little bit confused about for MHA. Because I know doctors, it's like very simple. It's like, oh, this is your issue. This is how you fix it.
Yeah.
With MHA, does it deal with more of the budget side? Like, what kind of problems do MHA people need, not MHA, my bad, health administration people actually have to deal with?
Yeah, so I mean, they deal with everything behind the scenes. So from operational inefficiencies to maintaining, financial budgets, to making sure you have adequate supplies, to making sure you're properly, all your faculty has all the proper competencies correct. Joint Commission, who is the accrediting body of all the hospitals, will come, so you have to make sure your facility is fully up to par with Joint Commission standards. There's just a lot of analytical stuff that goes behind into it to see how can we improve operations. I'm really interested in operations, so that's kind of why I'm gearing this towards more of an operation scope of things. But from patient experience to really seeing how from structure and design to consulting, I mean, you could do anything.
Really?
And I mean, especially nowadays with, you look at Amazon, you look at CVS, these big corporations who we traditionally didn't really think of as places where you could go see a physician or go see a nurse practitioner or a PA, they're now getting into that field. And so you're seeing a lot more innovation as well as consolidation within this industry.
Wow. So has it always been like this, or is it a little bit more of an up-and-coming kind of industry?
Oh, it's... Administration itself has kind of always been there. I would say that's been really prevalent in healthcare for a long time. I just think people didn't really know about it. I think with the rise of technology and social media, I think that really put a limelight on things that traditionally went on behind the scenes that no one really could see. So from that aspect of it, I do think it is a new kind of evolving field. But I also think, with these Amazons and with Walmart and with CVS and everything, we're going to see a lot of different trends in healthcare, and there's always room for administrators now.
So what difference do these Walmart, CVSs, and everything really do have on the impact of the health field?
It's so new that we haven't really seen the full extent of it, whether it's going to be harmful or beneficial. So it's gonna take some time. There's definitely a lot of kinks within it. You just think, oh, Amazon, it's going to be nice and easy. I'm going to log onto a Zoom call or whatever it may be, and it's going to be bam, just like that. But you got to think about a lot of other things. Are you actually getting the proper adequate care? Are you actually getting the proper diagnosis? Are you getting, how is reimbursements going to be paid out? Do you have the proper insurance? Are you even taking insurance, or is it cash paying? So there's a lot of different functionality and structural components that you got to think about. And I think that's where prominently is where the administration kind of comes in.
So could you say that health administration is basically getting the equivalent of a business administration degree, but more tailored to the health side of things?
I would say that's exactly what it is. Okay. I would say it's just like getting an MBA in healthcare. And a lot of universities have different routes about going about it. So University of Arizona actually had an MPH in healthcare administration.
Really?
Yeah, so you can, I'm not sure if the Keck School of Medicine offers that through their MHA program, or MPH program, excuse me. But I know a lot of schools do offer health administration through the MPH route.
Okay.
And you can also do an MBA. A lot of people just have a general MBA. A lot of people have an MBA in healthcare, and a lot of people have an MHA. So it's a pretty diverse group. Yeah.
As far as USC goes, what are some of the differences that you see between the MHA program and the MPH program?
So we don't really have a lot of connections with the MPH. They're on an off-site they're on the medical science campuses. So it's, that is one thing that was kind of a drawback for me about USC, was I kind of did want to have some collaboration and integration between those MPH students, because I feel like there is a lot to learn from them, and they can learn a lot from us. So it was really kind of a mutual transaction, the way I was looking at it. But I think the way Keck goes about it is a little more research focused, a little more biostatistical kind of focused, and so we're more on leadership, and I think a lot of our students want to go into a leadership role in healthcare. So I think that's kind of what we're geared towards.
I kind of love that, teaching how to already be leaders early on in college experience, and having other leaders kind of grind them into this next figure of what they need to be.
Exactly.
So with this degree, once you have it, what is kind of the next step? Do most people go into the workforce immediately, or do they get a PhD, go for an MD? How does it all work?
So there's a wide range of that as well. You do have people who are just going to get an MHA, and then that's it. Kind of like I think what I'm going to do. And then you have people who are going to go to PA school after, and kind of have a dual degree, an MHA and, or a PA or an NP. And then there are a handful of people who were doctors and now are getting an MHA, or are getting an MHA and going to try to go to med school.
Why would they pair it up together? Because I feel like they're very similar, but I feel they're opposite sides of the same coin.
Yeah, a lot of leadership roles do appreciate if you have a clinical background, because you understand where, clinicians are coming from in that perspective. But I feel like if you have a good grasp on that, it's not necessary if you want to stay in that leadership role. But if you're unsure and you want to, you don't know if you want to be a clinician and treat those patients, or if you want to be an administrator and kind of look at it from an operational and a financial perspective, then I think the MHA route would be the best for you. But we also have our residencies, so we have to do a showcase, we have formal interviews.
Oh, you guys have to do a residency?
Yeah, okay. So, but we do that the summer after our first year and going into our second year.
So the residency goes on into the second year?
Yeah, so I'm still doing my residency. I started in June. I'm at Cedars-Sinai right now.
Oh, nice.
Doing operations and neurosciences, and so that's been great.
Really?
Learning a lot. And it's great to be at such a prestigious institution, because you really get to learn from the best. And all the residencies are really great. No matter where you are or where you end up, it's going to be valuable, and you're going to learn a lot.
And what kind of work are you exactly doing in the hospital right now with these residencies?
So it's, again, very, very a wide range again.
Yeah.
So again, like you have people in patient experience, you have people in operations, you have people who are actually with like some C-suite members and kind of going about like kind of shadowing them day to day almost, but not necessarily shadowing them, just working alongside with them, which I think is very beneficial because you get to kind of learn the ropes of a position that you do want in the future. And then you have people, doing, working for startups that are like, apps, like there's a new behavioral health app. They reached out, and I think a few people are doing some residencies there. You have insurance groups, you have our own on-site campus health services. So there's one resident there. So yeah, it's very wide-ranging, and you could really do whatever you wanted with it.
I love that. I kind of love the freedom that allows you to have, where you're not really just thrown into one little niche area that you have to always be working at. It seems like MHA forces you to look at everything, a very macro view, where you see everything, you can be a part of anything, and you're not really put into one category.
Exactly. And I mean, it is a macro view, but you can also dive into a micro view.
Okay.
Excuse me, wherever you see that, you kind of want to go into and kind of learn a little bit more about, you can always go deeper into it. And I feel like, going deeper into it does actually allow you to solve, the root cause of the problem and see what is going on. Because a lot of times it is like a little micro level thing. And, taking a view from a 30,000 foot plane, it won't show you that. So getting a little bit deeper and diving deeper down will definitely show you. But I mean, that is what's beautiful about it, is the option to do both.
Yeah. And it's such a unique thing that you have to go into residency 1 year after taking all the courses and everything.
Yeah.
Is this a unique thing to USC, or do most MHA programs do this?
So it's about 50-50.
Okay.
A lot of programs, the programs that I applied to did. I thought that was something that was very beneficial. Just having, institutions come to the university knowing beforehand that they do want a student and that you are a student and that they're trying to train the next generation of leaders. So just having that in the back of your head is kind of, it makes me feel relieved in a sense, knowing that I am going to get the most knowledge, the best knowledge, and I can be, the best I can be at my job.
Yeah. And did you get to choose which program you wanted to go into, or is it already decided for you?
So there's about 70 different organizations that come.
Really?
So I should say like about 50 different organizations that come, but about 70 spots total. So some organizations take more than one.
Okay.
And so you initially kind of fill out your list of your top, I think, 20. And then from there you get a schedule of like 10 people that you are going to be interviewing with. So we have a showcase. Showcase is about 7 minutes per interview, and you have 11 rounds of that with different organizations. And then from there, they'll reach out and say, hey, we'd love to follow up with you. We'd love to get a second interview to get to know you a little bit more. Because 7 minutes is a really short time.
Yeah.
So
be able to tell who somebody is.
Exactly. Yeah. And so then from there, then you get, the crop kind of slims down on different organizations. And then from there, it's up to you whenever you get the offer or where you want to be, or whether it's paid or unpaid, because some are paid, some are unpaid. Yeah.
Why would anybody do unpaid?
I'm doing it unpaid.
You're doing it unpaid? Why would you do it unpaid?
Because I thought that I would get the best experience here, and to me, it wasn't about the money now or at all. It was it just in me advancing my skill set and really getting the best knowledge I can to make an impact. And so I thought, Cedars-Sinai would be that organization that would provide me with that experience I was looking for. And to this point, it's been exceeding my expectations.
For the most part, is it a trade-off, or if you go into the paid internship, you're not learning as much?
So it's kind of mixed. Some people feel like that, and some people just are money hungry and they just see the money and they say, you know what, I'll do whatever it takes.
Like, screw the experience.
Yeah, exactly.
Give me some more.
Exactly. And I find, from my own personal experience, that I kind of, I'm allowed to make mistakes. I'm also allowed to ask a lot more questions than I probably would be otherwise. I'm allowed to do a lot more things, like, shadowing C-suite, going to different departments, having my freedom of whatever projects I kind of want to work on.
Mm-hmm.
So I feel like that freedom kind of gets taken away from you when you start getting a paycheck.
Okay.
And I think, to me, that's not really what it was about.
Gotcha. Love that. So what is this program look like when you first walk through the door? I know that after the first year you have the residency,
Yeah.
but when you first start off, can you give us like a brief little, overlook to what it is?
Yeah, so those doors to Price are daunting.
Yeah, of course. They're scary. Yeah. See your own reflection out there.
Yeah.
I'm an imposter. I don't deserve to be here.
Exactly. I think a lot of the self kind of battles come from imposter syndrome, where it's like, wow, I'm at USC, like getting my master's, doing this, like this
it's
is
real.
awesome. Yeah. Like, it's kind of right there. But a typical day when I first arrived was we had 4 classes. So I don't know if you're familiar with intensives.
No.
But for those who don't know, intensives are basically kind of graduate level courses. What they'll do is, since people a lot of times are working and they're kind of coupling that work with their degree, they'll have their students come in on a Saturday or Sunday from like 9 to 3. So these last 2 days I've been in class from 9 to 3.
Wow.
But you only go in 4 times a semester instead of every single week.
Okay.
So it's like one weekend and another weekend, so 4 days total.
Okay.
So some people like that, some people don't. It gives you the option and flexibility of not having to do kind of school during the week. Obviously you have assignments and stuff, but actually being physically present, it definitely allows a lot of flexibility in that realm.
Are you able to actually learn though in those?
And that's the problem.
Yeah.
And so it kind of feels like information's being thrown at you for 12 straight hours.
Yeah.
And it's hard to kind of internalize that and really get your own perspective on it, because a lot of it is conceptual. I mean, a lot of it is you got to kind of apply the concepts to whatever you're doing. And the concepts and stuff are great, but you got to know how to apply those things. And so I feel like the application aspect of it kind of gets lost when the information gets thrown at you so quickly. But if you do have a good professor, I think they know how to get the most out of that time, because it is so valuable. And I find intensives with the right professor to be very beneficial.
Do you need to take an intensive, or can you go the normal class route of taking classes throughout the week at maybe just 2 hours?
Yeah, so most classes will have a weekly option, and most will have an intensive option as well. But there are a few that don't have a weekly option.
Really?
Or there are a few that don't even have intensive options. So it just kind of, I guess, depends on the nature of the subject. Like we had to do a statistics course, which we had to code and stuff, and there was no classes that were offered for intensives, because that is very much you have to do it week by week by week to kind of get it all down.
Make sure you have the fundamentals
Exactly.
really honed down. Okay. So you go into it, you have these intensive, you have 4 classes each semester?
Yeah, so 4 classes, to begin with in the fall. 4 classes again in the spring. People take either 3 or 2 in the summer. Okay. Because that's when residency starts, so it kind of starts to get a little bit heavy in terms of workload and kind of your bandwidth on what you can work on during the week. And then fall, I'm taking 4 this fall, but I only have to take 1 in the spring.
Ooh, that's pretty nice.
Yeah, exactly. So I thought I was going to be looking for jobs and stuff in the spring, and I kind of wanted to devote my attention fully to that. Yeah. So that's where my mindset was kind of like, let me just grind and finish it now. And on top of that, a lot of these concepts I'm learning now in class, I can apply to my residency. Really? So that was another, aspect of it, was like, I'm trying to learn all that information now, so when I still have time in my residency, I can implement these things.
And when you compare it to your course load for an undergrad, is it kind of similar, the amount of work, or what's the main difference?
So I would say undergrad is a little more regurgitation.
Okay.
I would say, at least for me it was. A lot more, reading the textbook, memorizing it, and then just turning the test in. And worked for me, but when I got to grad school, I quickly realized I can't take that approach. Because like I said, a lot of the concepts you have to apply, and that's kind of, it's not really exams, it's more projects. Okay. And collaborating with, your peers and other students and stuff like that.
Can you give us an example of one of these projects you've had to work on?
Yeah, so I just did a project for my quality class over the summer on medication errors.
Okay.
So there are about 400,000 medical errors that occur every year,
Damn.
and about 98,000 people die every year from it. So it's a pretty big problem, but no one wants to address it, and everyone just kind of wants to push it under the rug.
That's insane.
So yeah, we kind of did a project and on that and kind of developing and implementing other strategies to mitigate that. So we came up with a CDSS system, which is basically a clinical decision support system. So that can, when you put the prescription in or you put the medication in, that clinical decision support system will allow you to see, it'll pop up a red flag if there's an interaction with another medication that patient's on, or if it's the wrong medication, or whatever, wrong dosage or whatever it may be.
So for the months leading up to that project, were you guys analyzing all these things in theory and finding your own ways to implement it into the project?
So we actually put it together. So most of our projects are done in about a week or a week and a half. So when we get that project signed, we could probably get a good 3 weeks, but as every college student does, they like to push it off. And we're also really busy with other classes, and oftentimes the group projects kind of all coincide to like turning in at the same time for all 4 classes, of course. But
it's the college struggle. That's how it is.
It is.
Yeah.
Every professor thinks you're only taking that one class. But I think USC, at least the MHA program, has done a really good job at kind of allowing us to, they've been really flexible with working with our schedules. And the professors understand that, and they understand we're taking a heavy course load along with working. And it's not easy. A lot of people have kids, and a lot of people, have families and everything. So
really, in this program.
Yeah, and so like I said, it's anywhere from 21 to like 45.
Yeah.
So you get a wide range of people.
And how many people are normally getting accepted each year, or like how big is the whole program?
Yeah, so my cohort was about 80 students, give or take, maybe plus five people.
Yeah.
And then this year's cohort was a little bit smaller. I think at 60.
Wow.
So I don't know whether that's USC being a little more stringent on who they're allowing in. I would hate to say my class was a bad example, but or whether it's it's not as hot of a degree as it was before, but just going based off national averages and the labor of and Bureau of Statistics, I think healthcare administration is a rapidly rising field.
I feel like its competitor almost that's offered through Keck School of Medicine is the Masters in Global Sciences. Yeah. Did you look into that one when you were applying?
I didn't. I wholeheartedly just wanted an administration kind of leadership, heavy focused program.
Okay.
I knew I had the skill sets going into it to be a leader, but I think I definitely needed to kind of refine them. And it's always a continuous improvement. No matter how old you are, you can always get better.
Yeah.
So I thought USC would put me in the best place, at least at the early start of my career, to help me excel. And so far, it has. It's exceeded my expectations. The students are phenomenal. They're great, super bright, coming from all different walks of life. And I think that was another thing that really made me fall in love with USC was I have students from every single state now. It wasn't like Santa Barbara where it was just Northern California and Southern California.
Yeah.
And a few Central California. Yeah.
Yeah.
It was a wide range. And just the ability to understand people's perspective of medicine in another state is so beneficial because every state is different in the way their rules and regulations are for medicine. And so hearing their experiences was it really provided me a lot of insight.
When you look at medicine and compare it to other states and everything, because it's vastly different, would you be able to take this degree and maybe start working in another country?
So I do have a few people actually in my cohort who are thinking about that. And it's an interesting question. I think, this program is really focused on the U.S. health system. I mean, it's solely focused on that. And I think it even kind of narrows down more into California's healthcare system.
Okay.
But you can always, once you have this general foundation, learn about that other country's system. And it could be vastly different, but I think a lot of what we have kind of learned was how to be a leader. And I think that can translate into whatever country you are in. Mm-hmm. You just have to have the willingness and also the empathy to succeed.
It's very beautifully put.
Thank you.
Yeah. Look at you, already a leader. Let me ask you this. Now that you are approaching, you're kind of reaching the end of this degree, like you're getting more towards the actual job force and everything. Do you feel like the major was able to really properly propel you in the right direction into the working field?
I think it propelled me into the right direction, but from that point on, you have to make your own path.
Okay.
So you can only help someone. The saying goes, you can only help someone that wants to be helped. Mm-hmm. And so they really try to help us to secure, jobs after the degree, while we're in the degree. A lot of the residencies will even offer you a job post-residency. And so it's really your own initiative. Yeah. They really push you and they put you on that pedestal, but it's from you to jump from here to here.
Okay. And when most people do make that jump, what does the process look like? Are they still reaching out to old professors as well, trying to get help with some of the issues that they're still working on? Like, is that link still there?
I would say USC, just as a general in school, regardless of what degree it is, I feel like that bond is always there. Okay. I feel like, once you figure out you're a Trojan, you're always a Trojan. Yeah. And that was also one of the big things that drew me to USC was the Trojan family, Trojan network.
The Trojan network is not talked about enough.
It's not. And that was a massive, massive thing. Yeah. Because a lot of times it's not about what you know, it's who you know.
Yeah, you can just go on LinkedIn and just be like, oh, exactly. You're also a USC alum. You're working in something I'm interested in. Yeah. Can we have a coffee meeting?
Exactly. Yeah. And they're so willing to do it. And they're so willing to even take you in and kind of share their knowledge and expand and advance your own skill set. Mm-hmm. But yeah, it's been a great journey. It's been a great journey, but the process after it is so, I'm not even sure. I'm just going through it right now. Uh-huh. But based off what it seems like, a lot of people can either go into the fellowship route, which is they'll apply to a large university system or like a large organization, let's say, a Kaiser or, a Stanford or UCLA or USC. They all have fellowships. There you take a little bit of a pay cut. You make around $70,000. Okay. Anywhere from 70 to 100. I do know there are some in this area that do offer 100, but they're very prestigious and very hard to get.
Okay. And what do you normally do in these fellowships?
So you're basically getting a very, very extensive look at everything that is involved in hospital management and operations. Okay. I mean, you go to every single department. You get to sit in with the CMO, the CEO, CQO, COO, all of C-suite, essentially. And, then a lot of times they say that you should only accept a fellowship if you plan on staying at that organization for a long time.
Oh, okay.
Because once you do that, they want to keep you in-house. They don't want to give you up. You've already been trained within their own organization. All the system, all the care delivery, integration, and whatever it may be at that organization. So they really prioritize staying there. Okay. I personally didn't want to do a fellowship. I felt like I kind of got one with my own residency already. And so for that reason, I think what kind of the path forward is going to look like is obviously, the goal is to stay there long term. But if not, look elsewhere, see what other opportunities there are. And, a USC degree is not held lightly. So, anyone within this area knows what a great degree it is and the capabilities and qualities of that person.
I agree. So, what would be your dream job?
Dream job. So
you're at the top of the top, wherever you want to be.
Yeah. So dream job would be CEO of Cedars-Sinai.
Cedars-Sinai.
As a little kid, actually, I'd been saying that. I'd always looked at Cedars as at the time it was this famous person hospital and working there it was like that's not what it is. Like they provide care to everyone. And it just happens to be in that location. So, when the high clientele profile does come, it's like this whole big hoorah, but it's not actually the case. Yeah. And so that was always on my mind. And, And same with coming to USC. And so it's funny that both of those things happened. And now I'm so blessed to have the opportunity to go to school here and work there.
Yeah.
So, we'll see. We'll see what happens.
Now in 30 years, when you're actually the CEO of Cedars-Sinai, you can look back at this video and kind of smile at yourself like, oh, look at that. Yeah. It happened just like the USC thing.
Yeah, exactly. And then I would love to also go, to, I did a little bit of work in Central America, South and Central America in undergrad for dentistry and kind of setting up the infrastructure there for dentistry, because a lot of those remote villages don't have access to it. So just giving them the opportunity to even seek that care. So I think once I've kind of made a name for myself, I would love to get an organization or a group of physicians as well as administrators to go to these countries and kind of give back what we were so fortunate to have that a lot of times we take for granted.
What about it really spoke out to you, where you just felt that connection of wanting to go back out there and providing those services?
I think it's the smile on the kids' faces when they see you. I think seeing the impact that you can have and how easy it is to make the impact is kind of a very humbling feeling. You look at these really grandiose impacts that people make, and it's like $3.3 billion invested here, or $3 million, to this charity. But I think, we look at that and we say, oh man, we can't make a difference without millions of dollars.
Yeah.
And it's so easy and it's so real and so human to make these little changes and really help someone else that needs it. And I think that's what really speaks to kind of all of us as administrators. I don't think it's just me or even my cohort. I think it's administrators throughout the country have this kind of inclination to help people and really give back, because we realize how fortunate we were to have the healthcare that we did. And so seeing those other countries is really it's really disheartening. And it doesn't take a lot. It's very simple. It just takes someone who cares.
Yeah. Would you ever consider actually moving to a country in South America or Central America and really just implementing your own system there?
Yeah, absolutely. I think, when I'm older, that is the plan, to actually stay there for a little, maybe a 3-4 year stint. But long term, I don't see myself staying there. Okay. But I mean, obviously setting up the infrastructure takes time and developing a culture like that. So, excuse me. I do think it would take a few years. I mean, at the least a few years.
Oh, God. I feel like it would be decades to actually get a solid program set in place.
Exactly. And then also keeping that same care coordination there, because physicians are leaving, and a lot of times is these little villages and these communities trust those same people that came there. We kind of bridge the gap between healthcare and these villages. And so when you send new people in, they naturally kind of get a little bit skeptical. And so kind of keeping that same team is really hard to do as well. And getting people who are willingly going to go out there, because it's not something you're going to get paid to do. It's something that you have to do out of the goodness of your heart. And I think when you start to get a paycheck, that kind of gets clouded. So kind of subduing that thought and really realizing the smile on the face is more impactful than $100,000.
Yeah. So you first started doing this back in undergrad, right?
Correct.
What year were you?
I was a junior.
Okay.
Yeah.
Do you feel that played a role in you getting into the USC MHA program?
I would say it definitely did. I mean, there's no way to know for certain.
Yeah.
But I would say if you are looking to get into the MHA program, here at USC, they really value extracurricular activities, and they really value community involvement.
Okay.
And having those two things, I think no matter what program you apply to, or no matter what you're doing in healthcare, will always lead to success. Always just knowing that it's a community-first kind of industry, and also realizing that a lot of things you learn actually come from this community involvement. You wouldn't be able to talk with these people one-on-one. They wouldn't trust you otherwise unless you helped them.
Yeah.
So hearing their perspective, seeing where they're coming from, allows you as an administrator to see things from a totally different light. So I think they really value those experiences you had early on, because they really shape you in the future.
So overall well-rounded people, not somebody who's been in a bubble their whole life.
Exactly.
People that are actively going out, spending their own personal time, trying to make a difference, trying to have a greater view of this world and everything in it.
That's exactly what it is. I mean, I think they should put you on the admissions committee.
Are you guys listening? You heard it here first. I did want to ask, though, you said that $70,000 to $100,000 was on the lower end side for the fellowship program.
Yep.
What do most of the salaries look like? Because I know it's very different depending on what you get into.
Very different, yeah.
But, like, what do you think the range is?
So
after
it ranges.
a degree?
Yeah, so there's actually public data on this on Price's website for all of the, I think, master's programs. And our last year's 2021's graduating class was anywhere from $50,000, which is most likely probably a startup or a government kind of low-end job, all the way up to like 175, which is probably consulting.
Okay.
Are people who've had past experiences. So it's very, very wide-ranging, just like everything with this degree.
Yeah.
But again, I think it's what you make of it. It's how much you value yourself, how much you know your worth is, what you've learned, and what you can bring to that organization. And if you have the right culture fit, you have the right mindset, and you have the right knowledge, I think the sky's the limit. You can always negotiate.
If you had to give advice to somebody who's in the major right now and wanted to improve as a person, to be the kind of person that would fit in all these cultures, who would really be above and beyond, what kind of advice would you give them to really succeed and do well in this field?
I would say it comes down to being compassionate.
Okay.
I think being compassionate, being empathetic, is all about healthcare. And if you don't have those two things, then it might not be the industry for you. It's one of those things where you need to understand where the patients are coming from. You need to understand, you need to put yourself in their shoes and realize, you know what, this operational error had drastic effects. Maybe they lost a child, maybe they lost their mom, and like that emotional damage that is done is tremendous. So, you know, being empathetic, being caring, understanding where they're coming from is massive. Also, you know, being able to be quick on your feet, also being able to be a leader is everything. And if you can't lead, then you can't be a healthcare administrator. Or, I mean, I would say it comes down to any job, for that matter of fact. I mean, I just think being a leader is such a prominent part of someone's personality, and it makes an impact on those around them.
In addition to leadership, imagine working with somebody without compassion or empathy.
Yeah. And
two things that you really need in order to be succful. Yeah.
Exactly. And believe it or not, there's a lot of people in healthcare who don't have those two things, because healthcare is a very high, there's a high financial incentive to working in healthcare.
I think that's a big part of it. Another thing, too, is maybe at some point of your career, I feel like when you go into the health field, you really deep down to your core have to be a glasses half full kind of person, where at the end of the day, you can go home knowing that you're doing something in the right direction, that you're helping people, you're doing everything you can to make the world a better place. But at the same time, you see how screwed up the system is. Yeah. You have people die on you. You have all this pain. And it's real pain. Yeah. It's not the kind of pain that you get at other jobs where it's like, oh, I missed this meeting or something. It's I lost a patient. Yeah. I have to go talk to the son of this person or the family member. It's a very real thing where I feel like an important thing that a lot of really good doctors do is they don't treat you as a number. They treat you as a real person. They try to understand your family life, what you're going through, and be a part of that in a way to form that trust. Exactly. And I think that's all of it, is what you said at the end there, is trust. Mm-hmm. Is that trust between the clinicians and that patient as well as the leadership? It needs to be there. And if you can't bridge that gap between all three realms, then it's going to be a problem for all three parties involved. Mm-hmm. And so really understanding that patient isn't just a reimbursement check. It's not just a number. Yeah. That patient is a patient. They have a family. They could be a father. They could be a daughter. They could be a mother. Mm-hmm. They could be grandmother, grandfather, whatever it may be. And so really just understanding that there's so much more that goes into that person besides a sick patient. Yeah. is like you need to have that. Do you feel like a lot of people that go into this don't have that? I would say for the most part, no. I would say most people go into this industry for the right reasons. Okay. There's always going to be a handful of bad apples regardless of where you are. Mm-hmm. It has nothing to do with healthcare. I think healthcare allows you to see those bad apples a lot quicker because you are dealing with other people rather than another type of industry. But
for the most part, everyone is in it for the right reason and wants to do good and wants to see the change in the world. And it's just, had bad experiences with their own healthcare and have wanted to change it.
I agree. I feel like the healthcare system here is something that definitely needs to be changed, and that does create a lot of problems for the families and everything around here. So, walking into that as well, but trying to bring it back to the major, do you feel like there are a lot of misconceptions people have about the MHA degree?
I wouldn't say necessarily about the MHA degree itself. I would say more about healthcare administrators as a whole. I would say, a lot of times they're kind of looked as money grabbers, people who, make the highest paycheck in the hospital. Why are they getting all these bonuses? That's kind of the questions that the rest of the staff asks. But in terms of misconceptions about the MHA, I would say, it's been pretty accurate. Everyone is, again, like I said, there for the right reasons, very genuine, really wanting to see change. And again, I think the misconceptions will be there regardless of what industry it is.
So with all that, I know that you've had a very diverse experience here, a lot of highs, a lot of lows. Yeah. Can you speak to some of the lowlights of this major, or things that you definitely think that if you're the king of the hill or whatever, king of the castle, you can order whatever you want, you would want to actively change about this major?
Yeah, so I would say more integration between the first years. I think first years and second years, I think, coming here as a new student is very scary, it's very daunting, and a lot of people are from different areas, so they're not used to kind of like the LA culture, and if you're not used to it, it's a very daunting feeling.
Oh, it's a scary place.
Yeah, coming here. So a little more integration there and collaboration. And then I think a lot of times too, sometimes we take courses that might not seem as relevant or pertinent to what we need to be learning, or maybe the emphasis of that concept wasn't reinforced properly.
Sure. Do you have any in mind?
I'd hate to throw them under the bus like that, but
I don't think it's throwing on the bus. It's just like your own personal experience of what you don't think was as relevant.
Yeah, I just think there's a lot of financial and economic concepts that we kind of dived a little too deep in for what we needed to do. We weren't going to become financial analysts. We were going to become leaders, and we kind of needed to know, we needed to know a little bit about it, but I think we dove a little too deep into it, and we could have spent our time maybe looking at acquisitions and consolidation and what that does financially to organizations, because that is the general trend of where healthcare is going.
If you could go back to yourself just starting this major, what kind of advice would you give?
I would say don't take it too seriously.
Okay.
I would say I think when I got in there, I still had like that undergrad mindset. Like I said, it was regurgitation. It was like, oh yeah, I got to get the A. But I really quickly realized throughout all the courses I was taking, like I said, the regurgitation wasn't going to work. So I needed to actually understand the concept, internalize it, and not memorize it, but actually like understand it to make a change on the world. So when you have that mindset of, oh, I'm going to learn this because I want to impact the world this way, different world. You don't have to start reminding yourself 5 times to remember something. You just remember it. And so I think taking that mindset initially would have been very beneficial.
Do you think that reason why we all have this regurgitation mindset is kind of stemmed in the education system? Because I feel like even in high school, that's what it was.
Yeah.
A lot of the STEM classes, especially in college, are very much just, can you repeat back to me what I just said and what you read, versus really understanding? Because I feel like you go through so much material, it's hard to spend the time to really understand it down to its core.
Yeah, exactly. And I think that's where the distinction between a good professor and a bad professor lies. I have this one professor right now. I can speak nothing but the highest about him. He's, someone who is not about taking tests. He doesn't believe in taking tests. He thinks, there's no benefit to it. But actually understanding the concept, applying it, internalizing it, comprehending it, that's what's going to make the difference. So applying that concept to a project or a pertinent problem in the world, that's where you're going to learn the most. And I think that mindset, with all of it, the classes I've taken with professors that have had that mindset in a previous prior class that I've taken with him, I've learned the most in those classes. The classes where I don't have to sit there and memorize and take a test. And I can do it, no problem.
Yeah.
But it's like, am I really getting anything out of it? And really, is it like pushing my mindset? Is it advancing my knowledge? Is it advancing my skill set? No. Yeah. This is what is actually applying the concepts.
Yeah, and also at the same time, while applying, learning to use those interpersonal skills with your teammates.
Exactly.
To be a leader, to let others also lead themselves, to just go through the whole real life experience of what it's like to lead and to go through these projects.
That's a lot of it. I mean, you hit it right on the head. It's working with not your friends and you get randomly assigned into a group. It really, you really need to be flexible, and you really need to coordinate with those people and understand kind of their personalities and what your personality is and how that's going to affect the dynamics of the group. So that's a lot of it too, and it's tricky at first.
Yeah.
It's really tough at first. You're like, oh man, this group, but then you realize that every single person in your cohort has valuable knowledge to bring, and they all have a different perspective, and they've all had different experiences. So you can always learn something new. And if you're not learning something new, then you're not asking the right questions.
So just learn to become a sponge. Exactly. Learn to be wrong, learn to question everything, and just absorb everything from everybody else around you.
Exactly. I think being wrong is the best thing. If you're not asking questions, you can't be wrong.
I love it. Well, Nick, we want to thank you so much for coming on here today and sharing your story and your experiences with the Masters of Health Administration degree. It has been a pleasure to have you on.
Thank you so much for having me. It was an honor to be here, and I look forward to seeing what you can accomplish.
I'm excited too. You're going to be there with us.
Yeah.
All right, I'll see you, Nick.
All right, well, thank you.
Say good.